I knew that this trip would be an adventure, a life experience, and an amazing learning tool, which it was. What I did not realize was how much it would touch my heart and become a part of me.
I didn't know what to expect going into this trip. What I gained was beyond my expectations. I went with the intent of helping others. What I got was an experience of a lifetime and a new perspective on life. During our time in Belize, we got to take part in several different activities. Some of the activities we partook in were home visits, working with a phlebotomist, and participating in a health fair, and helping eradicate lice and scabies of an entire village. Of all the activities, the home visits most affected my global health awareness and practice. Health problems transcend national borders and affect all people around the world. Unfortunately, the means of treatment do not. We encountered many people with health disparities such as diabetes and hypertension throughout our home visits. However, we did not have the medications and tools we are used to having in the United States to treat them. We needed to rely on what little they had access to in order to provide care. A lot of our focus was on educating patients about healthier lifestyles. Even with education, we had to adapt our teaching using words our patients would understand and take into consideration the Belizean culture and the foods they had available to them.
The Hillside Clinic has to work with very little modern conveniences we take for granted in our clinical practices. Technology is sparse, medications are scrounged together from private donors, and some support from the Ministry of Health. The health profession is brought back to the basic skills. We would perform assessments while sitting outside on the grass as people would honk and greet us, or as chickens and children would run through the home. You learn to close out distractions and concentrate on your patient. It also taught us to rely on our feelings and skills, and not on the numbers from machines.
The most important lesson I learned during my trip to Belize was getting back to the fundamentals of nursing and the importance of listening to your patient. In Belize, we didn't have machines and gadgets to rely on to help our patients. Even lab tests took several days or weeks to get results, and oftentimes they were skewed or inaccurate. We had to gather our information by conducting thorough physical assessments and communicating with the patients in their homes. We had to rely on what the patients had to say and how they acted to identify any problems. Overall, my experience taught me that in order to provide better care, we as nurses must communicate and listen to our patients.
It's not me.
One of the first lessons I learned working in Belize was to accept the differences and embrace the loving people and the beautiful environment. When first entering Punta Gorda, a blatant social economic difference from the community that I was accustomed to was evident. The day after arriving, I went on my first home visit. The client's home was small and humble, but as I spoke and worked with this joyful man, the physical environment disappeared and the wonderful spirit and warmth of the client became the prevalent experience. This pattern continued through my stay. With each patient I had the opportunity to interact with. Every time I was welcomed into every home with acceptance and love, and the disparities disappeared. This experience made me grow in more than a professional, but as a human being. My love for the people would expand with each individual I met, and the appreciation for the welcoming, diverse culture of Belize was beyond what I thought was capable. This experience has made me more grateful. I am grateful for the opportunity of education we are provided in our country. I am grateful for the diversity the world contains and the similarities of love and kindness many of us share. I am grateful for the amazing staff of Hillside Clinic that provides such needed care at their own cost of time and money. I appreciate the great sacrifice they make in their lives to serve their brothers and sisters in this world. There are not words to describe the type of people they are and how they are true examples of what a medical professional should aspire to. I am grateful to the great group of students I have had the opportunity to share this life experience with. I have learned as much from each of them as from the instructors and patients I interacted with. In conclusion, I'd like to say how grateful I am to the staff, administrators, and leadership of West Coast University. This opportunity has changed my life to make me a better mother, person, and nurse in more ways than I am able to express. This trip and all the people I have met have touched my heart and will be a part of me forever.
My experience abroad has contributed to both my personal and professional growth. Personally, this trip was humbling. It has truly made me grateful for all that I have in life and the opportunities that I have been given. Oftentimes, it is easy to complain or want more. When I saw how people lived with not nearly half as much as we have, yet were still happy and grateful, it changed my perspective. Happiness isn't about having the best and newest gadget or making the most money. The people of Belize taught me the key to happiness is appreciating and being grateful for what I have and not what I want. Professionally, I was able to grow confidence in my nursing skills and comfort in communication with patients. This trip has provided me with a wealth of experience and knowledge that I will never forget.